I was diagnosed cancer 2006 on the right breast, an invasive aggressive cancer. And they wanted to take me both breasts away and the uterus. I refused, and I was trying to find solutions I couldn't find, so I got the address of the Dr. Simoncini, and I went to see him on 2008 in June. And that's when we started to do shots into the tumor, June, in August, and in September, I think. And every time I went to Rome, and then in January I went to see him again because my breast was strange, and that's where my general practitioner came with me, and that's Tullio Simoncini then decided that I should have an operation immediately. It was my breast cancer was about 14 centimeters, and my general practitioner found a surgeon who agreed to operate and to leave the drains inside. So the 2nd of February, I was operated, and I had my drains inside in the breast and under the arm, 4 drains. And after that, I had a treatment for 3 months of bicarbonate. We washed out whatever was in the cavity.
Right.
And 2 months later, I had a checkup with ultrasound, and everything was all right in the breast and under the arm. Again, 2 months later, I had difficulties to breathe, and my doctor made a radiography, and we saw that my left breast and my left lung was full of water. So I went to the hospital, and they did a punction, and then they checked the fluid, and they saw that there was cancer inside.
Uh-huh. This was the
After
pleura?
this, I went, yeah,
Was it in the pleura?
after the, in the pleura, yes, in the water of the pleura, in the liquid that we
Right.
took out. And after that, I had a PET scan done, and the results of the PET scans were that I had the liver was attacked, the lymphatic system, the spine. And so we continued. I went to Rome. I had a drain put into the pleura. I had a portacat put into my left arm, which is connected to the liver.
Right.
And we washed out the liver and the pleura again for about 3 months. And after 2 weeks already, we checked the water that we took out from the pleura, and it was free of cancer already.
Two
But we
weeks
did
after
that
you had 2 weeks after you started the washings, it was already gone from the pleura.
from
Yeah.
the pleura, yes.
Okay.
But we continued the washings, and for about 2 months, and we checked again and again 4 times, and every time it was free. There was no cancer cells left. In the liver, we did also a treatment for at the same time, also always alternatively, for about 2 months. And in end of September, I had another PET scan, and the liver was free of cancer, the pleura also. The bones were also free of cancer, so they considered me to be healthy.
But how did you do the bones? How did you clear the bones?
Oh, the bones, sorry. I had 5 sessions of radiotherapy.
So it could be either the radio, either the carbonate, or a combination of both. Should have both, as
Probably
far as you know.
both,
Okay.
because they were also astonished that everything was fine
Oh,
already.
so they were surprised then,
They
all
were
doctors.
surprised, and we
Okay.
also checked the how do you say the markers,
Oh, the markers,
and
yes.
and the markers were also free. They have never been. I mean, I never have any cancer signs in the markers.
So you have been now more than 1 month cancer free at this point.
Yes.
I'm a general practitioner. I'm also specialized in different natural therapy. I mean, homeopathy, Chinese medicine, detoxification, and chelotherapy, and also nutrition. I'm also the GP of Corinna.
So can you confirm that all these cancers were in fact cancers?
Yes,
Yeah.
yes, we can confirm that. We did the test in the hospital, and well, there was the piece of the operation. We can confirm with certitude that it was cancer, and also when we did the punction of the pleural cavity, we saw the cancer cells, so we can confirm with certitude that it was cancer. Yes.
And do you know if she's done any other therapies during Simoncini's treatment? I mean, I know she done
No,
radiotherapy for
she
the bones.
didn't do any chemotherapy or radiotherapy. Yes, on the bone. We have said that before,
Yes.
but
In your opinion, has the radiotherapy has had any part in the healing of the bone? Was it surprising by itself, or do you think it was both? Maybe the
I think it was both. Probably it was both because, well, I don't know exactly the percentage because I'm not a specialist of oncology like Dr. Simoncini, but Dr. Simoncini advised to do this treatment of radiotherapy on the bones because he has experience that it works, but it works probably also with the therapy of bicarbonate. Sure.
right, the two things together. Have you treated
Yes.
any other patients with this
Yes.
method?
Yes. Yes. Sure.
Can
Yes.
you tell me something general, like how many, what kind of cancers, and what results do you get?
Yes, no, yes, well, I can tell you. Well, unfortunately, I met Dr. Simoncini only since around 1 year, not yet 1 year, less than 1 year. So um, I, I was very interesting in this therapy and in his result he could obtain with this treatment. And so I began as soon as I can to treat people with this treatment, and we have had very good result. Yes, with Corinna, and with two other patients also with breast cancer. The treatment is not completely finished with this one. With one is completely finished, she is completely healed. Also, we have had very good results with a patient from Canada who had a kidney tumor with metastasis in the lungs, and the first result after one cure of 4 weeks were quite good. We have had 50% less of metastasis in the lungs. So it's a very good result. He should come back to pursue the treatment.
Wonderful. So, in general, do you agree with Simoncini's theory of the candida being the cause of everything? Or you're not an oncologist, I understand that.
Yes, but well, I can see the result. I have said that if we can help people, and I can tell you now that we can help people only with bicarbonate without any side effects. I think we have to do that. So, well, I would say I'm very happy to have this treatment to propose to the patient who come to my
Yeah.
clinic. And well, most of them are sent by Dr. Simoncini. But this is very, very interesting, and we have very good results, and once again, without any side effects.
Which is wonderful.
Yes,
Merci
this is
beaucoup.
wonderful.
Merci beaucoup. I appreciate
Merci.
your contribution.
Thank you to you.